So thank you for coming. So we're really excited here to have Alliance for Hope International. They are the technical assistance providers for our Polyvictimization Initiative. And Casey Gwinn and Natalia Aguirre are here to speak to us about the initiative and the results, the findings, and Hope Science. So we're really excited to have them, and I'm going to let them tell them about themselves.
Well, thank you, Stacy, and welcome all of you for being here today. My name is Casey Gwinn. I'm the president of Alliance for Hope International, and we're very honored to be with staff here from OVC and folks watching online from a variety of agencies, including OVW and OVC, and some of our folks in San Diego joining as well. It's nice to have Darlene Hutchinson here, who's the director of OVC. Thanks for joining us today. And Susan Williams, who is the former deputy director of OVC, who's also with us. As we share today, we're going to be talking about our Polyvictimization Initiative. Polyvictimization is a topic that has not been discussed much outside of the OVC arena, except to the extent that it's been talked about in the child welfare world, primarily, historically at least. And our work around polyvictimization over the last few years has become incredibly significant both to our organization and we believe to the entire field around violence prevention in the years to come. So I'm going to set some context as we get started today, and then in just a few minutes I will introduce Natalia Aguirre, who is the director of our Polyvictimization Initiative, working with Stacy and the team at OVC. As we get started, I want to just begin with a story, because polyvictimization and adverse childhood experiences are not about statistics. They're about people's lives, real people that we interface with and work with, and many of us have been personally touched by in our own lives, me included. But I'm going to start with a story about a boy who called himself Alex. Alex was a camper in 2012 in our Camp Hope program. We run the largest camping and mentoring program in the United States for children impacted by child abuse and domestic violence. And I met Alex at a campsite in the mountains east of San Diego in 2012. When I first saw him, he was covered in a hoodie with a baseball cap with sunglasses, and he had his name tag covered up under his hoodie. So I actually didn't know his name. I just noted the first day that I saw him at camp that he ran hot and that he had a lot of challenges in his life. And I decided to stay close to him over the course of the days of camp at the campsite that we were at. And by the second day of camp, I could tell that he was having challenges. I'd lost track of him for about an hour, and I was looking for him while we were standing in line for lunch when I heard a voice behind me that said, "I want to play goalie." And I turned around, and there he was. And I said, "Okay, you can play goalie." And I by then could see his name tag, and it said Calvin. So I said, "Calvin, you can play goalie." I didn't know where the soccer game was because we were in line for lunch. But I said, "Okay, Calvin, you can play goalie." And he said, "My name's not Calvin, my name's Alex." "Okay, Alex, you can play goalie." And then I saw that behind the dining room was the soccer field, and there were kids in the back of the lunch line that were actually kicking the ball into the net while they were waiting to go into lunch at the camp. So I walked with Alex over to the soccer field, and I introduced him to the other kids, and I said, "Alex would like to play goalie." And they said, "Sure, he can play goalie." And so I put Alex in the goal box, and then we had two boys playing defense and a boy and a girl playing offense, and they were just going to kick the ball in the goal. But I stayed close to Alex, not really knowing how he would navigate that whole situation. And as he stood in the goal box, he stood like this. He never moved. He never blocked a ball. He never used his hands. He never used his feet. He just stood with his legs crossed and his arms crossed in the goal. And the kids had to go get the ball. They kicked the ball in the goal. Then the defenders had to go get it, or the offensive people had to go get it. He never moved for about 7 minutes. And finally, after about 7 minutes, a 9-year-old boy who was playing defense turned to Alex and said, "You suck at goalie," which was a true statement that he sucked at goalie. And as soon as he said, "You suck at goalie," Alex triggered like that and attacked him and said, "I will effing kill you." And then he swung at him, closed fist, as hard as he could. And I was 3 feet away, and I caught Alex around the waist. And as soon as I caught him around the waist, his rage turned toward me. And we're not a behavioral intervention camping model. We don't have guards. We don't have security details of any kind. But in the behavioral intervention world, the safest way to restrain a child who's violent like that in that situation is to get their arms at their sides and sit them on the ground until they're able to kind of regulate. And so I did. I didn't take him to the ground because there was a block wall behind the soccer net. So I backed him into the wall, and now his rage was full-fledged. You're an effing dead man. You better let go of me. You're hurting me. You're abusing me. I'm going to kill you when you let go of me. We sent all the kids to lunch. We have a rule of threes in our camping world, so no adult is ever alone with a child. So 2 other adults stayed with me, and Alex raged like that in my arms for about 40 minutes. While I did nothing to criminalize him or to blame or shame him, I just said, I'm so sorry you're upset. I know you're mad. I know that hurt your feelings. It's okay. Let it out, Alex. Let it out. And after about 40 minutes, he started to regulate and come down. I didn't know his story, by the way, that day. I didn't know his story as a child before he came to camp. I didn't know his mother's story. I didn't know his family history or a generation before he was born. I didn't know any of that. All I knew was I had a rage-filled boy in a setting where, but for intervention, he would have hurt someone. And so after about 40 minutes, I very matter-of-factly said to Alex, in just a few minutes, I'm going to let you go, and you have a choice to make. You can go attack that boy that hurt your feelings, Alex, and I'm going to call 911 and you'll go to jail today. Or you can attack me and I will call 911 and you'll go to jail today. Or this afternoon, we're going to go canoeing on the lake. And if you want to go canoeing, we can go canoeing this afternoon. It's your choice, Alex, jail, or canoeing. And he said, let me think about it for a few minutes. And I started to let go of him, and he said, don't let go of me yet. And about 5 minutes passed while I held him. Wasn't really restraining him anymore. He had regulated. He was calm. He'd breathed with me. He was calm, but he just sat silently in my arms. And after about 5 minutes, he said, what does it feel like to go canoeing? I've never been canoeing. I think I'd like to go canoeing. And I said, you can go canoeing this afternoon, Alex. It'll feel great. Imagine what it'll be like to be on the water. And we'll have fun and we'll splash and it's warm. And if we get water on each other, it's okay. And if we fall in the water, it's okay. We'll have vests on. We'll be safe. And he said, I'm not a good swimmer. I don't really know how to swim. What if I fall in the water? Will you take care of me? Will you keep me safe? I mean, what would I do? And I said, you'll be safe. You'll be okay, Alex. And that afternoon, we went canoeing. He then joined our year-round mentoring program, connected at the time to the San Diego Family Justice Center, and he began going to activities all year long. Started going to counseling at the Family Justice Center, working with a child trauma therapist, and beginning to tell his story about things that had happened to him in his life before the age of 12. And during that journey, he started coming to camp every summer. 2 years later, I took this picture of Alex on the Klamath River, and I began to see hope in the life of a rage-filled boy, almost 14 years old in this picture, as he started to realize that his life could be different than his parents, that his life could be different than the things he had experienced before he came to Camp Hope. And over the course of a period of years, he kept coming, and he kept coming. And by the age of 16, he said, I've decided not to call myself Alex anymore. I want to call myself Calvin because that's my real name. And I said, why did you change your name to Alex? And he said, because I thought if I changed my name, I'd be different from the way I was before. And he said, but I'm starting to learn that what happened to me is bad stuff, and I'm having normal reactions to bad things that happen to me. It's not about me, it's about the things that happen to me. And over the journey, he ultimately became a counselor with Camp Hope America. This is Calvin going into his senior year of high school in 2017, and he started becoming a counselor for our little kids, 7 to 11-year-olds at Camp Hope America. And then when he was 18 years old, I took this picture of Calvin, again counseling his second summer. He was now 18 years old and 6'2" and 185 pounds. If he triggered at this age, I wouldn't be able to restrain him. And if he triggered at this age in the presence of a police officer, it could become an officer-involved critical incident very easily. But by then, he was beginning to process what was happening to him. And just weeks after he counseled for his second summer, we gave him a $1,500 Verizon scholarship to go to college. And Calvin is just finishing now his second year at Southwestern College in San Diego. He didn't go to juvenile hall. He didn't go to jail. He's not going to prison. He's going to college because he began to navigate through the trauma that he experienced as a child, to the things that happened to his mother that ended up impacting him, to the things that happened to his father that ended up being acted out upon him. And he began to realize that he could be a different person and set different goals in his life and navigate different pathways. So I start with this story about Calvin because Calvin is why we're sitting in this room today. Calvin is why we have this initiative, because children like Calvin and both boys and girls that grow up in homes with violence and abuse experience that trauma and often repeat it into the next generation without effective intervention. But he didn't repeat that cycle. He's not repeating that cycle. He's never assaulted a woman or a girl. He is learning how to navigate through the anger that is a natural human emotion from what he experienced as a child, and he's beginning to set goals about who he wants to be in life. So as we talk today about polyvictimization, whether you're thinking about the journey through adverse childhood experiences into adult victimization that produces at times victims of sexual and domestic violence, or you're thinking about perpetrators or aggressors who navigate through that journey and become aggressors or abusers out of the violence they have experienced or the victimization that they have experienced, I want you to keep Calvin in mind. I do want to thank Stacy and Darlene and the whole team at OVC for the Polyvictimization Initiative that we're going to talk about today. We are doing some work right now that I believe will point the way forward for the Office on Violence Against Women, for the Office for Victims of Crime, and for HHS and for others throughout the federal government and in organizations across the United States as we think about this dynamic that relates to what happens to children, how that plays itself out in adulthood, and then what we do about it in the process of moving from trauma to hope, in the process of moving from trauma to resiliency, in the process of moving from trauma to a life filled with well-being and not with victimization and repeated victimizations and repeated traumas. It's also an honor for us to be here today to represent the team at Alliance for Hope International, our organization. We have staff here in Washington, D.C. We have an office in Fort Worth, Texas, and most of our staff is based in San Diego, California. But we represent a group of people, many of whom have our own journeys through victimization in our lives, who are beginning to figure out a lot of things about what it means to break this generational cycle of violence and abuse. I also want to recognize Bryn, who's part of our team, who's on the Polyvictimization Initiative team that Natalia has been leading over the last couple of years. I want to specifically thank Bryn for her work on our most recent report on the first phase of our Polyvictimization Initiative, but to really recognize the challenges that we've had in this and the things we're learning. And where the polyvictimization work really starts is something that you're all familiar with, the Adverse Childhood Experiences Study. The Adverse Childhood Experiences Study was really the beginning of this journey in the late 80s and early 90s by Dr. Vince Felitti and later Dr. Rob Onda and Kaiser Permanente and the CDC into this whole conversation about the relationship between childhood trauma and adult illness, disease, criminality, and victimization. And that certainly is where we start today. Thinking about Calvin's journey and victimization that happened before the age of 12 in his life that was incredibly significant, the particulars of which are not necessary to talk about here today. But that adverse childhood experiences work that started in the 1990s first began to transform our work as an organization in 2012, 2013. I was honored to write a book with Dr. Vincent Felitti in 2015 called Cheering for the Children about the Adverse Childhood Experiences Study. And in 2015, we began measuring ACEs in our children coming to Camp Hope America, and then later in adult survivors of sexual and domestic violence coming to family justice centers. But the adverse childhood experiences is the beginning of this journey, and it's important to understand where polyvictimization will take this. The ACEs study focuses on only basically 4 major areas of trauma produced out of 10 questions that only look at one-time victimization or individual victimizations. Doesn't look at anything that happens after the age of 18, doesn't look at cumulative trauma. If you've been molested 100 times as a child, ACEs doesn't pick that up compared to being molested once. But in the ACEs world, it nevertheless has produced, as many of you know, all kinds of significant predictive dynamics that occur from unmitigated trauma in the life of people growing up with violence and abuse. But polyvictimization began to come along as we started looking at the lifespan impacts of adverse childhood experiences. And Dr. David Finkel and Sherry Hamby and others many years ago started looking at this question of, okay, so you have a significant childhood trauma experience, so you have an ACE score of great significance, greater than, let's say, 3 or 4, that begins to impact other things in your life. What happens after 18? How does that play itself out? Not just in looking at health impacts, but in looking at other kinds of victimization. And as we begin to do that in the work around polyvictimization, and we adopted Dr. David Finkel and Sherry Hamby's work, we started seeing what you see on the screen there, this really lifetime impact and things that ACEs didn't pick up. So many types of victimizations, both in childhood and in adulthood, that don't show up in the few categories that are measured in the Adverse Childhood Experiences study. So for the purposes of this presentation and for the purposes of understanding polyvictimization, we're going to use this slide. Polyvictimization really is what Sherry Hamby calls the experience of everyday trauma that happens in someone's lives, not just a few narrow things that might happen once, but things that happen over and over. And the visual in this slide was not chosen by accident. In the polyvictimization work that's now being done by our organization and others working with adults, not working with children, but working with adults, we're beginning to hear this statement over and over again. It's like I have a cloud over my head. It's like everywhere I go, bad things follow me. It's like no matter what I do, it seems like I always end up in a bad situation or people do bad things to me. This notion that there must be something wrong with me because I seem to always end up in this situation where more bad things happen. And what we soon realized as we began our polyvictimization work was that's a normal reaction to previous victimizations, that victimization opens up the door for other victimizations, that predators find compromised human beings that have trauma experiences from childhood, that coping mechanism choices might be made that may produce vulnerabilities in certain populations that put you in situations where other victimizations can happen, and that may play itself out over the course of a lifetime, particularly if you're unaware of what's happening to you, if you haven't been able to navigate through it and understand it and be aware of it and the choices that you might make even unconsciously about it. So polyvictimization in Sherry Hamby's words is really about everyday trauma. But it goes beyond just this notion, as I said, of ACEs. It goes to a whole category of experiences that ACEs doesn't pick up. Everything from community violence to bullying to historical trauma to historic oppression to so many types of things that play themselves out in people's lives. After Hurricane Katrina, we were working with the New Orleans Family Justice Center, and we heard so much conversation about the trauma experienced from a natural disaster. And trauma from natural disaster is very profound, but if you also have a high ACE score and adult victimization, the trauma of a natural disaster is compounded dramatically. And so we've never looked at natural disasters as being related to trauma for sure in this population. And so you can see on the screen as we begin to look at this, we begin to talk about the collective experiences of someone's life that go way beyond what it means to be experiencing violence or abuse as a child. And in the development of the polyvictimization world, you all know that we've also been talking more and more about trauma-informed care and trauma-informed principles. And we'll talk more about that as we go today. But the reality is that if you want to become a trauma-informed organization or you want to become a trauma-informed person, you have to learn this shift from what's wrong with you to what happened to you. And if you really want to ask the question of someone what happened to you, you can't simply focus on what happened before the age of 18. You've got to be willing to ask the question, what happened to you, and focus on their collective experience in their life based on all kinds of factors that have to be taken into account if you're going to help them contextualize or understand what's gone on in their lives. So this particular slide here begins to show you kind of the earliest work of Dr. David Finkel on the national survey related to exposure to violence. And Dr. David Finkel's work was initially very much focused on children in the child welfare world, as he and others were beginning to look at this relationship, not focused on defining an adverse childhood experience alone, but beginning to talk about victimizations in general. And if you watch how this slide flows here, the 38.7% is looking at children who had been experiencing victimization of some kind. And general victimization may include something like witnessing domestic violence, for example, not necessarily considered direct victimization of physical or sexual abuse, but some type of victimization. 38.7% in his study reporting more than one type. But of those children, 64.5% also reported direct victimization, the actual physical abuse or sexual abuse or experiencing something beyond just indirect or vicarious trauma. And then you get to this more defined population, a smaller population, albeit, who reported 5 or more direct exposures to different types of violence and abuse, and down to this population that reported more than 10. The thing that becomes so fascinating about this is now that we have taken Dr. David Finkel's early work and started looking at this in the people that we're working with in community-based collaboratives called family justice centers or multi-agency models, we're finding that it's not 1.4 of our population, it's the majority of our population in family justice centers. So that 1.4 is dramatically overrepresented as adults in the work that we're doing in intervention with people in crisis from sexual assault, domestic violence, human trafficking, elder abuse, and related violence and abuse. So I'm going to ask Natalya to come up. Natalya is the director of our Family Justice Center work at Alliance for Hope International. She's also the director of our National Polyvictimization Initiative with the Office for Victims of Crime. And I'm going to ask Natalya to take over from here for a little while and walk you through a particular example of a situation so you can see this lifespan piece, which is what polyvictimization is now about, that we're talking about.
Okay, so to add a little bit more and kind of illuminate why polyvictimization is important is because this information is also predictive of future and severity of the type of victimization that's occurring. So if we look at Julia, for example, and a lot of time when we're talking about polyvictimization, in this example, we're talking about in the span of 12 months. So in 1 year, a person kind of experiencing multiple types of victimizations in different areas of their life, different environments, and by different people. So if Julia had had her house broken into, was emotionally put down by her father, was bullied at school, watched gang fights, witnessed violence between her mother and her father, and was maybe made fun of because of her accent or where she came from, these are all victimizations that would be measured in the polyvictimization framework and the initiative that we were working with. And what we realized as we dove into the literature and really began looking at the work was that family justice centers were really doing great work around kind of intercepting or doing preventative work around most of the pathways that lead to polyvictimization. And so in the research, we had found that there are really 4 ways that polyvictims come about. One is dangerous families, where children are experiencing maltreatment, there's assault or domestic violence. There's also family disruption and adversity, so there's poor supervision or emotional deprivation. There are also emotional problems, so there are either poor social skills or impaired self-protection or stigma. But the one area that we really realized that family justice centers were not doing extensive work around, but was a key kind of pathway to polyvictimization, was this dangerous neighborhood. So children or adults witnessing property crime, witnessing violence, peer victimization, or sexual victimization in their communities had a direct impact on their lived experience throughout their entire life. And so then the question really became, how do we adapt and equip family justice centers to be able to address this idea of community violence in the family justice center model as well, and create space for survivors to talk about those experiences when they're coming for services. And so the impact of polyvictimization, like Casey said, a lot of times correlates with what we see in ACEs. So you can see that you have deteriorated mental health, you have changes in behavior and decreased physical well-being. But what was really what stands out around polyvictimization is the fact that it's predictive of this future victimization. So when there's a polyvictim, they are 2 to 7 times more likely to be victimized in that next year of their life. And not only are they more likely to be victimized again, but the level of severity of the types of victimizations that they will encounter increases as well. So survivors have a 4 to 6 times more chance of having a more serious victimization in that next year. And so then we really began to think about, how do we break that cycle of violence and really provide services targeted to this population who is so vulnerable in order to prevent future victimizations in their life. And so what we found is that victimizations are not randomly distributed. They tend to accumulate for certain people in certain environments, and therefore it becomes a condition for folks. And so what is our role as service providers or as funders to really think about how to change this outcome for survivors in our communities? And the way that this presents oftentimes in family justice centers or in programs that are providing services is that we see survivors who are coming in who have an inability to trust others. They reject direct support. They have this idea that danger is everywhere. They're physically reactive. So if we think back to Calvin's story, they hold on to grievances. They are having a really hard time and have a really hard time with change and transitions, and oftentimes our programs require change and transition for them to move through that service delivery model. And they're unable to recognize similar dynamics that give the same results. So again, when we're thinking about why polyvictimization is predictive, you begin to see how some of these behavioral impacts really directly correlate to the probability of survivors being victimized again. And so we've really had to focus on, with our service providers, about making sure that these very sometimes difficult and challenging traits that survivors are presenting with in our centers are really just kind of the top of the iceberg. They are just presenting with these behaviors, but underneath, it's our role to then connect to the pieces, talk about all of the trauma, whether it's ACEs or polyvictimization, and how that's affecting their behavior outwardly. Casey, did you want to jump back in?
So as we got into the polyvictimization research, and Natalia's early lit review in this went through all of the research and all of the tools that were out there on polyvictimization. The question that OVC had framed in this initiative was whether family justice centers or individual organizations were in a position to be able to begin to address this kind of complexity in victimization. And the answer was yes, if it's done in a truly integrated multidisciplinary fashion. The problem that we saw, even family justice centers at the beginning of this initiative, was that people still work in silos. Individual agencies are very siloed in what they do, and we're siloed in disciplines. Child abuse folks are siloed from sexual assault folks, that are siloed from domestic violence folks, that are siloed from elder abuse folks, that are siloed from human trafficking folks. That's certainly true, but it's also true that the cops are siloed from the advocacy advocates, and the advocates are siloed from the prosecutors, and the prosecutors are siloed from the mental health professionals, and so it goes. So we realized that even in a collaborative like a family justice center, we still had a lot of fragmentation in beginning to see this big picture of how all these victimizations relate to a human being, and then how we can come and meet that person where they are in that journey and help work with them collaboratively around it. The other thing that we found kind of very clearly in this work is that most of our focus in the work, even when we talked about being trauma-informed, was really looking backwards. We spend most of our time, in fact, working with survivors looking backwards. What happened to you? Even if we shift to a trauma-informed lens, what happened to you? We're still spending an enormous amount of time looking backwards in all of our work. What happened to you if it's a crime? What happened to you if you're getting mental health assistance? What happened to you if we want to really understand things? And so kind of this focus on the past and focusing backwards was not a pathway to well-being for a lot of our survivors, particularly if they were going to be more likely to be victimized again in the future, and looking back didn't solve that problem. So we realized early on that if we were going to kind of begin to flesh out what a polyvictimization framework could do, that we were going to have to figure out how to understand the person, not only by looking back, but beginning to look forward. And one of the things that happened in that journey was allowing us to really begin to see not just what had happened to the person or the struggles that the person had, but what the strengths of that person were. The polyvictimization work, when it's really rich, connects to positive psychology. It connects to strength-based approaches and beginning to understand who somebody is and how they've survived what they've gone through and how they can begin to look forward. So that was certainly part of our journey. The contextualization was important. It's certainly important. Most of you know that in the original work by Abraham Maslow and Maslow's hierarchy, Maslow put self-actualization at the top of his hierarchy. And self-actualization includes the ability to contextualize what happened to you in your past in order to figure out who you want to be in the future. So we know that looking back is important to some extent, but as we sometimes say, look back but don't stare. And the less time you spend looking back as you move toward well-being in your life, the better place you're going to be going forward in your life. So we begin to kind of think about that piece. We also begin to think about kind of helping survivors see the interconnections that we had to offer. So even in the work that we do, prevention work tends to be siloed from intervention work. And we tend to focus basically kind of over here on policy or over here on crisis intervention or over here on prevention work. And we begin to realize that we had to do all those things because you've got a person in crisis, but you've also got a person who's now at risk for future victimizations. And secondary prevention isn't just about stopping what's happening, it's about preventing it from happening again. And so we begin to kind of understand the importance of intersecting all of those things. So we did tell OVC early on in this initiative that we felt like family justice centers were a great opportunity to think about polyvictimization because in most of our family justice centers around the United States, of which there are more than 125 now, these are centers where we not only have crisis intervention work going on, but we have prevention work going on, and we have multidisciplinary work going on. So we felt like we had a framework to basically begin to move beyond just crisis intervention and triage and begin to move toward kind of a more comprehensive approach. We also realized that if this was going to be meaningful, particularly working with adult survivors of violence and abuse, that we had to actually challenge the organizations to change too. We couldn't just come in and say the leadership of our collaboratives was going to think in a more trauma-informed way or better understand polyvictimization. We had to challenge cultures of organizations. And the slide that's represented here kind of develops this whole thinking around kind of assumptions, values, and what we call artifacts, or kind of the structure of organization, some of which you can see visibly. A law enforcement agency is a pretty a regimented chain of command kind of an organization. You can look at a law enforcement agency from the outside, and you can see that it's a hierarchical chain of command type of organization. What you can't see that's invisible inside a law enforcement agency is the desire of law enforcement to control everything, to be in control. It's part of safety for law enforcement, to be in control, to be able to control variables and control people in situations that are unpredictable. That's almost invisible in the culture of the organization unless you've worked in law enforcement and you understand how law enforcement works. So as we begin to think about law enforcement officers beginning to understand polyvictimization, about prosecutors beginning to understand polyvictimization. And prosecutors are by definition reactive. Prosecutors by definition spend all their time looking backwards. That's the whole point of historic prosecution, is looking backwards. So getting prosecutors to change their paradigm, to start thinking about what the forward piece looks like for them in their role in a collaborative. You can see how that analysis could be applied, whether it's to medical service providers or spiritual care providers or cops or prosecutors or any other system that has a culture surrounding it. So as we begin to think through that, we knew that we had a framework that we could apply to it. Most of you know that we opened the first multi-agency collaborative of its kind, 25 agencies in the United States in 2002 in San Diego. It was the first time anybody ever had put 25 agencies under one roof anywhere in the United States, working with child abuse, sexual assault, domestic violence. Child advocacy centers were certainly a precursor to family justice centers. Child advocacy centers tend to have 5, 6, 7 partner agencies in most of them. If you look at the members of the National Children's Alliance, certified child advocacy centers, even the largest centers don't have more than 10, 12 partners. So when the San Diego Family Justice Center focused initially on domestic and sexual violence, not on child abuse, and put together 25 agencies, that was the first of its kind in the country. And since then, that initiative has been expanding and expanding and expanding with the support of the Office on Violence Against Women, with the support of the Office for Victims of Crime, and with an enormous amount of work by local government in a lot of communities across the United States. So we felt like that framework had the potential to really help us understand this. And for those of you that aren't familiar with family justice centers, the whole notion is simply a pretty straightforward premise that survivors should be able to come one place for everything they need. That in most systems in the United States, survivors have to go from agency to agency and silo to silo and tell their story over and over and over again. That's true today in most communities in America. And if you're a child, if you have children and they've experienced child abuse and you're an adult survivor of violence and abuse, those two things happen in two different places. One would happen in a child advocacy center. The other might happen in a community-based sexual assault or domestic violence agency, and then in a police department. And then if you go into the criminal justice system there, if you go into the civil justice system here. So this notion of the Family Justice Center is trying to figure out how to create a collaborative where survivors can come one place for everything they need. It sounds like a really simple, common sense idea that is incredibly difficult to do, incredibly difficult to make work, and incredibly difficult to work for survivors. To get those agencies with all their different organizational cultures without an understanding of polyvictimization or adverse childhood experiences or anything to come together and then change the paradigm for how survivors get help. But that's the notion behind the Family Justice Center framework. It's really the CAC model on steroids is what it is, and a much more complicated idea than the CAC when it comes to simply being able to focus on child physical and sexual abuse. We included a slide here that's actually from the Center for Family Justice in Bridgeport, Connecticut, to kind of illustrate this. The Center for Family Justice in Bridgeport is a community-based sexual assault domestic violence agency that about 10 years years ago, began the journey of morphing into a collaborative. They now operate as a family justice center with a centralized intake process, but they didn't start there. They were a community-based sexual assault, domestic violence agency, run a domestic violence shelter. But I show this slide because you can see where they started. They were primarily an advocacy organization, community-based advocates working in a confidential, privileged environment with individual survivors of sexual and domestic violence, advocating for them, referring them to services, trying to get them the support that they needed in the system. No other agencies on site, just their staff working, some on mental health work, some on advocacy, some on risk assessment and planning, but nobody else present in that model, just their people in the crisis intervention model. And then when they started morphing, they first added on-site law enforcement to their model, which is a pretty standard thing now in family justice centers. And they quickly saw what we've seen around the country. Law enforcement officers act differently when they have to work every day with advocates. When they have to be co-located with community-based advocates, they think differently, they do their job differently. And so they added law enforcement first. Then they added civil legal services and prosecutors, and they found the same thing. Prosecutors act differently when they work side by side with community-based professionals. They think differently, they have a different view of the world. And they added civil legal services, which today is now the #1 service in every family justice center in America is civil legal services. But you can see how this evolved. Then they added mental health resources. They already had them for adults, but then they added them for children. Then they added a whole variety of agencies working on physical and sexual child abuse. Then they expanded their services for sexual assault victims to involve support after the crisis, after the case was adjudicated. Then they began to add child welfare services into their mix, on-site housing, screening, and support services. Then they began adding culturally and linguistically relevant agencies from the community to bring their staff into the collaborative. Then they added a wellness center, including yoga, and a variety of other wellness kind of strategies. They added a comprehensive interfaith counseling program because most of you know that spiritual care is incredibly important to survivors of trauma, and it doesn't matter what you believe. It connects to all kinds of trauma and the importance of meeting people where they are. Spiritually or with their faith or beliefs is obviously central to that. But you can see how this evolution happened in Bridgeport, Connecticut, and we like that slide because today the Center for Family Justice is leading Camp Hope, Connecticut, and they're running a mentoring and camping program for children exposed to domestic violence out of the Center for Family Justice. So they're dealing with adult and child sexual and physical abuse survivors, and they're dealing with not just crisis intervention, but long-term care and support, including this year-long, year-after-year camping and mentoring model as well. So you can kind of see what that Family Justice Center model looks like. And I could give you 50 stories from centers across the country that have a different journey, but that's kind of the evolution of the Family Justice Center movement. So you can see why it made sense that when OVC said, we need to figure out what polyvictimization work looks like with adult domestic and sexual violence survivors, we felt like family justice centers were a good place in order to do this initiative. So we did apply to be the TA provider for that initiative. We were selected in a competitive process along with the initial demonstration sites in that initiative. And phase 1 of that initiative is now ended and phase 2 is just beginning in that initiative. But I'm going to let Natalya kind of walk you through the initiative so you kind of see the background here of this. So we begin to understand ACEs. We realize that this is not just about ACEs. It has to be about victimization through the span of a lifetime. And then it has to be about what does that mean for services and support in agencies across the United States. And so that initiative is where we are now. And I'm going to let Natalya kind of walk us through the demonstration initiative. Yeah, sure.
Organizations within that building prevents them from all reacting in their own, just implementing their own programs in their own silos.
Like, what's the glue that ties them all together, and is it a is it a multidisciplinary kind of thing? Do they have case management, that kind of thing?
The Family Justice Center is really a co-located, coordinated community response, in essence. It's really about bringing agencies together, not just in co-located services. There is a movement in the country right now about co-located services. There are nonprofits that are all moving into a building so they can be more accessible to each other, so they can save on overhead, maybe share HR expenses or share on accounting or financial kind of management. The Family Justice Center is not that. It's not simply a co-located model. It's an integrated model. So the goal is that what brings you together is a set of common principles and beliefs that you all share and agree to. So there's always a strategic planning process that should go with developing a Family Justice Center. I'm not saying that's happened everywhere, but there should be a process where we decide what's our vision, who do we want to be, what are we going to believe together, how are we going to operate, and then there's a structure that comes over it. The goal is generally a centralized intake process, so survivors only have to do their demographics once. They don't have to do their demographics with 25 agencies. They only do risk assessment and safety planning once. They don't have to do that with 15 different agencies. So they come into a process, but it's a survivor-centered kind of choice-based model. So if a survivor comes in, the Family Justice Center has to be committed to the principle that she or he is not coming there to be told who to talk to or where to go or what to do. They get to choose who they talk to or where they go or what they do. So if they don't want to talk to the law enforcement agencies, they don't talk to law enforcement. In fact, in our model, law enforcement wouldn't even know they were at the center. If a survivor didn't want law enforcement to know they were at a center. If they didn't want the prosecutor's office to know they were there, they wouldn't even show up in the intake system. If the prosecutor's office were to try to check it, they wouldn't be there because they don't want to talk to prosecutors. They want to talk to community-based agencies. So it's a set of principles, and it is a framework and a structure, much like a CAC in that sense, one intake process. We have not yet gotten to one interview. Our original goal was the survivor tells their story once. That has not happened yet in any Family Justice Center in America. We have a dream of that happening one day with forensic interviewers, where we would do for adults what we've done with children and try to have one interview. But that's really the framework for it. So if someone says they're a Family Justice Center, and there are such places that say we're a Family Justice Center, but they have no centralized intake, they have no coordination process, they're all just in a building together, that's not actually a Family Justice Center, not under the Violence Against Women Act, not under our definition of a Family Justice Center. There has to be this cohesive set of values and beliefs and structure around it. Natalia?
That was a lot of information. So what did we do with it? I'll kind of go through phase 1 and phase 2, and then some of our lessons learned from the initiative. So our phase 1, we had set up to have 3 very big, ambitious goals. One was systems change, and that involved creating an actual screening tool or an assessment tool, and then changing how we deliver services based on the use of that tool, and developing a trauma-informed understanding of polyvictimization. At the organizational level, we really wanted to make sure that we integrated culturally responsive, survivor-centered approaches, expanded self-care for staff because we understood that there were going to be changes in the scope of work that staff were having, and then also expand community services to include more holistic approaches. And on the individual level for survivors, we were really looking at measurable outcomes, focusing on hope and healing and justice, and then collaboration at the staff level, the people working at the centers. And in our first phase, we had 6 sites we were working with: Sonoma, California, Stanislaus, California, Tulsa, Oklahoma, New Orleans, Louisiana, Milwaukee, and Queens, New York. And in our second phase, which we just started this past October, we have kind of some more goals of, 1, implementing the tool into new sites that have received funding, expand the framework, and then network the new sites and the continuing sites, and really further develop organizational and support hope and survivor-centered approaches to healing and community building. And the 5 sites that we're working with this time around include Sonoma, Tulsa, and New Orleans, which are continuing sites, and we have 2 new sites, which is Oklahoma City and Chattanooga, Tennessee. And we have been very fortunate to have experts and national partners that have been working with us throughout both initiatives, and we call upon in different aspects. So we called on Dr. Finkel when we were really beginning to think about polyvictimization, Dr. Vincent Folletti with ACEs. We had extensive conversation with Kim Roth, who's the director of one of our family justice centers in Strength United in Van Nuys, California, Dr. Linda Chamberlain, Dr. Brent Crandell, and Ted Corbin. So they all have expertise in different areas and have really helped facilitate and help us think through the guiding principles of how we use our assessment tool. And then our partners for this grant have been Dr. Chan Hellman from the Hope Research Center in the University of Oklahoma, and Raul Almazar and Charles Wilson. And so we really brought a wealth of national experts to really help us think through this process. And we realized quickly that we needed to define what trauma-informed really meant if that's what we were going to live out. And oftentimes we have this ambiguous idea of what trauma-informed organizations are. And so the way that we really worked to define this was, one, we had to screen for trauma exposure and related symptoms. So our tool could not only have trauma kind of screening, but it also had to include symptomology screening. We were going to provide evidence-based, culturally responsive assessment, treatments, and support. So again, this idea of moving away from just crisis intervention, but really this long-term community building for survivors. We were going to work with survivors, their children, families on the trauma response, its impact, and the treatment. So we're not only working with the one person coming in, but really looking at this in a holistic way as how this functions with the family. And as Casey mentioned, we had to think not only about the past, but about moving forward and how we were helping survivors and their families build resiliency, hope, and these protective factors to really break that cycle of violence in their lives. We also realized that we had to work with children and caregivers. That's why Camp Hope, we'll talk about this later in the presentation, is such a key part to the polyvictimization framework, emphasizing collaboration among the systems and professionals working in the centers. So again, making sure that they're not fragmenting and siloing, but we're really thinking through the centralized intake piece. And then, of course, caring for the staff working at the centers was really important, focusing on secondary traumatic stress and vicarious trauma, and increasing staff wellness became a really huge learning curve for us as we were going through the initiative as well. And then, of course, mutuality among survivors, families, and professionals. We were not dictating what they had to do, but this was a survivor-led process, and how we created quality among the service providers and the people receiving services was really important. And of course, addressing the intersections of trauma. So we were not only going to be looking at the what event that brought them into the center, but how culture, history, race, gender, and language could have compounding impacts on communities and the response that we're providing. And so the tool itself, as Casey mentioned, we had a really extensive literature review process that involved us reviewing 198 articles and tools, which we narrowed down to 30 that we sent out to all of our sites, and these are all validated instruments that were already out in the field. And we analyzed them and then came up with a set of questions and assessment tool that we now have. And really the reason why we wanted to do this was, one, to provide holistic services to better understand the entire needs of the people coming in, to create a community for survivors in our centers, and to mitigate the impact of trauma, to document the prevalence, of course, so to have a better understanding of what polyvictimization looks like in adults coming to the Family Justice Center, but to ultimately create a feedback loop in all of our centers that would then provide information back to service providers to better understand population, who else needs to be on site. So the final assessment tool that we all developed has 26 event-based questions and 18 symptom-based questions, and you can see some of the categories here on the tool itself. But again, it distinguishes between the different areas of their life and when these events happen. So it looks at childhood, it looks at their entire adult life, and also in the last year, because of the predictive nature of polyvictimization, that last year was really critical. And it includes all of the topics on ACEs, the adult adverse experiences survey, and everything kind of listed on Vision 21 was really important for us to kind of fulfill as we were thinking through the document. On the symptomology section, we talk about suicidality, self-harming behaviors, and PTSD screening. So there's a 5-question validated PTSD screener in the assessment tool that is also used. And so we tried to integrate kind of the best of the best and make a comprehensive basket or an assessment tool for folks to use in family justice centers. And as Casey said, it's really important for us to have a vision of how all of these things are implemented. So these are some of our guiding principles about what the tool is and is not. And so again, the tool is an information integration tool for frontline staff. It's meant to gather all of the information that survivors are kind of presenting with when they're coming to a family justice center. It's really a great way to begin having conversations around psychoeducation and connecting these dots for survivors. It helps catalog events and symptoms throughout the lifetime of survivors. It's meant to be conversational. It can be utilized over in a number of sessions. So by no means is somebody coming in and filling out an entire polyvictimization assessment tool at one time. And again, the point is not to only be looking backwards, but really to integrate that with a strength-based manner and a hope-centered approach to really be thinking about how to move forward as well. And so again, it's not a self-report, it's not diagnostic, and we were really careful to think through how this tool and the information collected on this tool was shared or not shared with partners, and what consent meant when we were talking about sharing the tool in family justice centers. And it was not only to provide data, so we didn't really, at the end of the day, this initiative and the tool was not meant to just to give us numbers, but to really guide service delivery. So first and foremost, the reason we were using this tool was to really help survivors in a holistic way. And so what we found, as Casey said, was pretty staggering. First of all, we found that 90% of clients coming into family justice centers were polyvictims across the board. And this is not only polyvictimization in their lifetime, but in the last year. So when we think about that in the context of our work, we're talking about survivors that have lived at least 5 victimizations in the last 12 months before accessing services. There was a huge correlation between the number of victimization survivors were living in the last year and the number of trauma symptoms that they were experiencing, all of which I think intuitively we knew, but having the data to really back that up was really important. And that survivors consistently said that feeling affirmed and validated and having the space to talk about some of these difficult experiences that they had in their life were really, really important. Oftentimes we had survivors say, this was the first time that I was ever asked this question or given the space to talk about something that I lived through in my childhood or in my teenage years. And so it was really important, again, not only in terms of service delivery, but as a healing process for survivors to have the space to talk about their entire life, regardless of what they may have come in for services for. And then what we also saw as a result of that was that clients who participated in the polyvictimization assessment tool were much more likely to return for ongoing services at family justice centers than those who did not engage in that process. And so some of the data, and I know this is a little hard to read, so I'll highlight some stuff. It comes from our 6 sites from phase 1. So you can see from Tulsa, Queens, Sonoma, New Orleans, Sojourner, which is Milwaukee, and Stanislaus. And this is information gathered from about 400 polyvictimization assessment tools with adult survivors. And again, I will highlight this is information in the last year. And I think to me, that's always shocking and staggering to think about. These are the lived experiences of folks in the last year, not just across their lifetime. But what we can see here is really, really high self-reported levels of emotional abuse, assault and battery, stalking, financial abuse, which we all expected to see in family justice centers since that's usually the entryway for a lot of survivors, but also a high disclosure of poverty and substance use. Almost 50% of our survivors disclosed either themselves using substances to cope or as a coercion mechanism by their partner, or that their family members or close family members were using substances as well. And then a really high interaction with the jail, prison, and probation and parole. So the yellow doesn't mean anything in particular. It's just things that we've kind of found shocking in the research when compared to kind of national levels. And you can kind of see on and on the high levels of victimization across the board.
I want to make one comment there just to highlight something that Natalia just talked about. It's this relationship between substance use and victimization. For those of us that have worked in this field, and I've been in this field for 35 years now, this is not something terribly shocking to us, but this is important. We're working on an initiative right now around substance use with Neil and Patel and the OVW team that Katie Sullivan challenged us to work on this last year that has dovetailed with the polyvictimization work in a very profound way. This is Dr. Daniel Sumrock. Dr. Daniel Sumrock is from the University of Tennessee. He runs the Center for Addiction Sciences at the University of Tennessee, and he's very involved in the adverse childhood experiences connection community that we are also very much a part of. And one of the things that he said not too long ago is addiction should not be called addiction. It should be called ritualized compulsive comfort seeking. It is a normal response to adversity experienced in childhood, just like bleeding is a normal response to being stabbed. And when we actually started to develop the polyvictimization tool and then apply it, we saw exactly this, this ritualized compulsive comfort-seeking behavior around substance use, this self-medication piece of substance use in 50% of all of our survivors coming into family justice centers. So that piece to me was incredibly important, and you can see the change in language from just this is a disease or you're addicted to something to you're struggling with a normal response to bad things that have happened to you. And you can see why that's such an important piece of the polyvictimization work that we're doing now and how it dovetails between the OVC work and the OVW work around substance use.
And I think really spoke to the importance of addressing all of these things at the same time and the failure of our system if we're only looking at substance use and not talking about the kind of traumatic experiences of folks in their lives, how we could miss opportunities for change. And similarly with our survivors, we also saw that victimizations were consistent across their entire lifespan. So this is from those 400 survivors. They reported kind of ongoing victimizations from childhood all the way through their adulthood and then in the last year. So again, kind of really showing how polyvictimization is a true trend and a real phenomena in people's lives. And then along with that, the symptomology or the physical experience that survivors are having as a result of the numerous victimizations in their life is also very high. And so you can see most of our survivors that we worked with reported anxiety, repeated memories or images, sadness, sleep disturbance, being hypervigilant. And this is again in the last year actively having these trauma symptoms to a level that it's disrupting their normal life. And we saw very high levels of experiencing pain. So 51% of the survivors coming into our centers were physically experiencing some type of pain that was not diagnosed. So whether that was stomach issues or chronic pain, things that they had not dealt with. And again, how our systems are set up to address all of these needs of survivors in one place. And then suicidal ideation and self-harming thoughts, again, higher than the normal national average. But again, how does this play into a coping mechanism for survivors who are experiencing very high levels of trauma? This is a really interesting analysis of the data that we received. It's a principal component analysis, which again shows the correlation and how we could be missing the point as service providers if we're not creating space for survivors to talk about their whole experience. So I'll kind of go from left to right. So in the first box, K1 over here, what it shows is that for a survivor who came in and disclosed strangulation, more often than not, they were also living through assault and battery, stalking, they were held against their will, and emotional and verbal abuse. And so that kind of shows how polyvictimization is, again, a real concept in the lives of survivors. So if we move down to 2, if they disclosed trafficking, they usually also disclosed other forced sexual activity, sexual abuse, and bullying. Again, number 3, if they disclosed chronic discrimination, they also had other types of abuses, separation from their children, or suffered from community violence. And again, this seems very intuitive when we talk about it, but again, if a survivor was coming in and we only asked about one thing, how it's very likely or possible that other things are also going on, or that we're not asking the right questions if there's not disclosures that kind of go beyond that initial disclosure that they're coming in for support. And so we learned a lot of lessons from this first phase of the initiative, which we're now integrating into phase 2. Kind of the biggest was this increase around empathy and understanding and connection between survivors. We really pride ourselves in Family Justice Centers about having very empathic and caring frontline staff. And something that always struck me was how I always heard survivors or frontline staff say, I have more empathy and understanding of the people that I'm working with now that I have given them the space to really tell their entire story. It has made systems and programs more flexible. A lot of times I think we say you have to do this to be successful in our program. So you have to go through step 1, 2, and 3, and we kind of take on as service providers the failure when they don't kind of make it through that program. But I think this initiative has really helped service providers think about how healing is not linear and it goes back and forth, and why people are making difficult decisions or are having adverse reactions to situations that we're asking them to change very often. And some of the feedback from survivors that we received is, thank you for asking me for my whole life. And these are quotes that we had from focus groups and kind of submissions from centers. This explains what has happened to me. So a lot of times survivors didn't even notice the pattern of victimizations that they've had in their whole life. They didn't know that their physical experience and their anxiety or their inability to sleep is connected to what they may have been living through for so many years. And a lot of times that these unrelated pieces of their life and their experience are connected has been a really kind of wonderful part of the tool. And something that just happened a few weeks ago when we were in Oklahoma City is we were talking about polyvictimization with some survivors. And somebody said, if somebody had just talked to me about polyvictimization and the context of my life, it would have made me realize that this is how I was raised and that these were the things I was seeing as a child, and that this is my life now. And therefore, this is probably going to be how the life of my children could be if I don't change something as well. And so this idea of intergenerational trauma and how survivors are able to connect what happened to their parents, to their life, and what may be happening to their children has been a really big motivator for change with a lot of the survivors that we've been working with. And again, this strength-based approach, the importance of really helping survivors not only identify what happened to them and how they're feeling, and sometimes these negative and difficult, heavy subjects to talk about, but the importance of helping survivors identify what is working with their life and helping them provide and develop their coping resources. So what are the things that are helping them? How do they self-care? What does healing look like? That's not often a question service providers ask survivors themselves, like, what does healing look like for you? And then helping them celebrate the small successes, no matter the size, as we provide services with them. It's also made us really think about nonlinear service delivery. So our frontline staff could no longer only be domestic violence advocates or just sexual assault advocates. They really had to have a broad understanding of trauma as a whole, and also have the specialty when somebody was disclosing something that needed help. So it really expanded the scope of work for frontline staff in Family Justice Centers and has been challenging us to think about what that sweet spot is between a generalist and a specialist in Family Justice Centers. And also shocking, I think, to me, because we live with so much trauma in family justice centers or work with people with so much trauma in family justice centers, was the importance of addressing staff support. When we expanded the framework and we're asking frontline staff to really ask folks about the entire experience of trauma in their life, they reported much higher levels of vicarious trauma. And though they were trained advocates and experienced advocates in family justice centers, this was kind of an unexpected consequence of the work that we were doing. And so really addressing staff support and creating supervision and debrief and kind of formal and informal structures of support for staff was really, really important. And then collaboration also became really critically important. So we realized that the Family Justice Center, even with 10, 15, 20 agencies, could not address the entire work. And if we weren't integrating the work and really coordinating that work among service provider, it was really difficult to do justice for survivors through the use of the assessment tool. So the assessment tool really led to an increased opening conversation, a look at how processes and structures look between partner agencies and how to really coordinate services at a deeper level. And also bring in those non-traditional partners. So we really had to think about how do we bring in substance use providers into family justice centers. If we have 50% of survivors are reporting using substances or having someone close to them using substances, what does it look like to have substance use providers on site or a healthcare system? So we had some of our family justice centers that became community-based, had open community-based clinics on site at their family justice center in order to really address this really huge gap around medical care. And then we brought in providers like yoga or acupuncture or dance and singing, and again, these very non-traditional methods of healing for survivors now that we were kind of moving down that road. Signs of hope?
Thanks, Natalia. The other piece that came out of this as we began to think more and more about where we're going is if we understand polyvictimization now, if we better understand this lifetime journey through victimization as a child that exposes you to a greater likelihood of victimization as an adult, so what? Like what now? Okay, so we're going to talk about it. But what then? Where do we go? How do we get there? And it's ironic that I would be standing here at the Office for Victims of Crime talking about this today, the science of hope, because 5 years ago, I didn't know you could measure hope in a human being's life. 5 years ago, I thought hope was optimism or wishful thinking. I would say, I hope it's going to be warm today in Washington, D.C., and I would think that was hope. It took me a while to figure out that that wasn't hope because I have no control over the weather in Washington, D.C., so it's actually, you might think, I'll think it's warm today because it's sunny outside. It's really nice. It's freezing outside for a Californian. But it turns out that saying I hope it's going to be warm today is not hope. But I didn't know that 5 years ago in my life. So as we got into the polyvictimization world, it was so timely in our lives that we had met Dr. Chan Hellman, the leading hope researcher in the United States of America at the University of Oklahoma. Chan runs the Hope Research Center, and we began to learn that hope is measurable in a human being and that hope is more predictive of well-being than anything else in a person's life, including everybody sitting in this room, including everybody watching by video, including all those who will hear this later. And as I began to learn this 5 years ago, and then 3 years ago, we began to move into this polyvictimization world, you can see why we began to realize they were connected, that hope was something that we had to better understand because we're all in the hope business. And if we didn't help survivors find hope in this journey, they weren't going to have a pathway out of polyvictimization. There wasn't going to be a way to break the cycle or go down a different road. So hope is the belief that your future can be better than your past and that you play a role in making it so by the goals you set and the strategic pathways you identify to get to your goals in life. Pretty simple, straightforward. That definition of hope has existed since Rick Snyder validated the child and adult hope scales in the 1990s at the University of Kansas. It's been the same definition used by Gallup in measuring hope now in schools across America with children grades 5 through 12, and in measuring hope now in the general population in Gallup national surveys. But that understanding of hope and the need for people to have hope in their lives if they're going to be able to experience well-being intersected with everything that we have been doing in the Polyvictimization Initiative. So early on, when Susan Williams and Stacy Phillips were working with us to begin to think about what are our goals in this, we said we've got to increase hope. We have to figure out how to increase hope. And even when I advocated for it at the beginning of the OVC initiative, I didn't fully understand it. Just a year and a half ago, Chan and I put this quote in a book called Hope Rising, that in every published study of hope, every single one after our 2,000 studies evaluated in a lit review, hope is the single best predictor of well-being compared to any other measure of trauma recovery. This finding is consistently corroborated with other published studies from top universities showing that hope is the best predictor for a life well lived. And you can see why it was important for us to begin to think about this, because if hope is so predictive of trauma recovery, if higher hope people do better in life than lower hope people, higher hope people do better out of cancer than lower hope people, higher hope teachers do better in school with kids than lower hope teachers, higher hope employees do better in the workplace than lower hope employees, higher hope survivors of sexual and domestic violence do better than low hope survivors, we needed to figure out how to increase hope in that journey. And when Chan Hellman first told me in 2013 that hope was measurable, I actually laughed out loud. And I said, you can't measure hope. And he said, I'm a quantitative psychologist. I can measure anything. And I thought, oh, and you're arrogant too, that you can measure hope. But he wasn't being arrogant. He was simply stating what Rick Snyder and Shane Lopez and others had already proved at the University of Kansas and at Gallup, that you can measure hope. And so we began to look more deeply during the PolyV initiative at the thinking around this, that hope is about goal setting, hope is about strategic thinking, pathways. Every one of you, if you set a goal in your life, you have to think of pathways to get to that goal. What are the steps to achieve whatever goal it is, whether it's where you're going out to dinner tonight, what you're going to have for dinner at home, how you're going to get to work tomorrow, the littlest goals or the biggest goals. Who do you want to be in 5 years, or what do you want to be doing in 5 years? And as we started to begin to understand this relationship between agency, which is the motivation to pursue goals in life, and strategic thinking, which is the pathways process of how you get to your goals, you can begin to see how important this is with polyvictimization, because somebody who has been robbed of hope in life is someone who has been unable to set their own goals, someone who has lived under the power and control of another human being who doesn't get to set their own goals in life. That's in the victimization world. You can see how this relates to the perpetration world, too, in a criminal justice system that says to an offender, we're going to tell you what your goals are and what you're going to do and what you're not going to do. And then we wonder why they fail. And they fail because they're not their goals. They're being imposed on them externally by somebody else. And most of the goals are negative. They're not approach goals or positive goals. You don't hit your wife again. Don't abuse your partner. It's a negative goal. Treat women and girls with respect. That would be a positive goal. But that's not what the criminal justice system does. It says, don't do this, don't do that. And it turns out low hope people use negative goaling. That's what a low hope person does. I'm not going to drink again. I'm not going to do this again. I'm not going to do this again. And so as we begin to understand all of this, and Chan laid it out really simply, agency is your motivation to pursue your goals. Willpower, way power is the ability to think strategically about how to get to a goal. You can see how someone robbed of hope as a child, who didn't get to set their goals in childhood, who didn't get their childhood to be what they wanted it to be, could end up being victimized again as an adult because they don't have their own goals and pathways. And now that re-victimization drives them even further away from being able to set their own goals and pathways. So when we developed just 2 years ago this hope continuum that Dr. Shane Lopez and Dr. Rick Snyder had begun to kind of think about in the early 2000s, you can see how this makes so much sense in the poly-view world. If hope is the belief that your future can be better than your past and that you play a role in making it so by the goals you set and the pathways you achieve, the closest thing to hope is anger, rage, and frustration. So Calvin, where we started today, got angry. Why was he angry? He was angry because Calvin wanted to be treated with respect and kindness by the people around him. He wasn't thinking about being a good goalie. That wasn't on his list. His list just included nobody yelling at him or screaming at him or calling him names. And when that 9-year-old says, "You suck at goalie," he actually had a normal reaction, Calvin did. He was angry that he was being put down like that. He didn't want to be put down. His goal was unstated: treat me with respect, be kind to me. And so he had an anger reaction, a natural, normal human reaction. Everybody in this room, you get on a freeway tonight and you're stuck in traffic on the Beltway or anywhere else, or you're stuck in the metro and you can't get where you want to go. You get frustrated. I want to be home by X time. You can't get home. You get frustrated. It's a natural, normal human reaction. My goal is to get home by 6 o'clock. You don't get home by 6 o'clock. I'm so frustrated. It took me till 6:45 to get home tonight. That's frustration. Natural, normal human reaction. And the most extreme form of that is rage. So a child growing up in a home with violence and abuse that can't set any goals, their first reaction is they get frustrated and angry. And the low-grade fever of kids that end up in the juvenile justice system in America is about the robbery of hope. It's victimization from adverse childhood experiences that produces rage. And when you're angry, you at least still have goals. You're angry because you still have goals. But when you start to lose your goals in life, you end up in despair. You can't get to where you want to go in life. You don't know how to get there. And the opposite of hope in all of our work in this initiative has become apathy. When a person gets to the point where they say, "I just don't care anymore," or "nothing's ever going to change," the strangulation assault survivor walking into a family justice center that thinks he controls every aspect of my life. He decides whether I live and die with his hands around my neck within seconds. She's not setting any goals for her life. She has none. She doesn't know how to get there. She can't get away from him. There's nothing I can do to change anything. That's apathy. And so you can see why this continuum began to make so much sense in understanding polyvictimization. And then we started measuring it using the adult hope scale and the children's hope scale, and we used the adult hope scale throughout the first phase of the Polyvictimization Initiative. And it should be no great surprise that we found that when hope was low in people's lives, they didn't navigate through trauma as well. When hope started to go up, they started to make different choices and set goals in their life and do better. So higher hope people would do better out of polyvictimization than lower hope people. The scale is pretty obvious and pretty clear. So when we started to pair these two things, people's polyvictimization scores with their hope scores, we began to see what was happening. And when we saw somebody doing better in life, we could measure it. If you measure hope in someone's life, you say, "We got a great program. We're doing this, this, and this at our agency to help victims of trauma, violence, and abuse. Prove it." Well, we just know. They're just doing better. They feel better. They say they're feeling better. They're just doing better. Prove it. This is how you prove it. The answer is you can measure hope in their life. And when hope goes up, it actually predicts higher levels of well-being. So that's what began to happen as we started looking for successful outcomes in this journey. And this is the next phase of the Polyvictimization Initiative. It's our Nurturing Hope Continuum. So when I first saw the hope scale, I thought, so you go from hope to rage to despair to apathy. So does that mean to get back to hope, you have to go from apathy to despair to rage to get there? And Chan said, no, we're going to be able to nurture hope. And Natalia just said it. She talked about the goals of survivors beginning to set their own goals, even the littlest goals. And it turns out in the research that's all true. Hope nurtures hope. And any of you that have done direct services know this is true. If you can get somebody to set the smallest goal in their life and then achieve it, they feel better about themselves. And then they set another goal, and then they feel better about themselves, and then they set another goal. But if you impose the goals on them, the likelihood of them succeeding at those goals is very low. It's why any external goaling mechanism usually doesn't work very well in someone's life, especially trauma survivors. But we begin to see the power of this. So we've got to help polyvictims begin to set goals, the smallest goals in their life. Then we've got to be able to help them begin to think about the pathways to those goals. And then I did this with Calvin. I said to Calvin as he was processing everything, imagine what it'll feel like, Calvin, to be out on the water this afternoon, splashing and laughing and having fun in that canoe. I was creating a future memory for him that hadn't happened yet. And he could try to imagine what it would feel like. And it turns out that in the research of this initiative, we have verified that. If you can't imagine your life different, it will never change. If you can't imagine the different person you want to be, you'll never be different. You've got to be able to imagine something. In fact, that's Maslow's hierarchy. Self-actualization is the ability to imagine your life different and then actualize that vision into the future. To actually move from living out of your amygdala, out of the fear center of your brain where you're hypervigilant and firing all the time about everything around you, to moving back to the prefrontal cortex and beginning to think about strategic pathways and goals that you have in life. And moving out of the amygdala to the prefrontal cortex is the pathway to hope in someone's life as they begin to set goals. And they have to be able to imagine. Just an aside, it turns out that damage to the brain from traumatic brain injury, concussive incidents, strangulation assaults, very often damages the hippocampus of the brain. In fact, there's a great deal of published research now on traumatic brain injury and domestic violence victims, and estimates that DV victims may be suffering traumatic brain injury in as high as 70% of all victims in the United States of America. And when it's severe brain injury and you suffer hippocampal atrophy, the shrinking of the hippocampus is the memory center of your brain, you have a harder time imagining the future different because you've actually suffered a brain injury. And it's harder for you because to be able to set future memories, you have to contextualize your past. And if your past is all a mess and it's jumbled and you don't understand why what happened to you happened and why you've done some of the things you've done and why predators have now found you and done more to you, you have a hard time imagining future successes in life. And therefore, you have a hard time getting to hope in your life. So you've got to figure out how to navigate through that. And we've got to help survivors figure it out and understand what they're going through. So that's the nurturing of hope that has led us to our thinking about phase 2 of this Polyvictimization Initiative. It's not just giving faster restraining orders or getting someone into counseling faster or prosecuting a case or helping them connect to spiritual care. It's about welcoming people into something that they can belong to long after the crisis. So the future of our polyvictimization work now that we've let survivors tell us about their lives is not to pat them on the back and say good luck to you now that you've been able to talk about your life. It's actually to welcome them into something. And I'm going to use just one example before we close and open it up to some questions, and that's our Camp Hope America program. So whether it's an adult survivor or a child survivor, it turns out that hope has to involve things where people can look forward to something. Survivors have to be able to see a different future and be able to navigate to it. Kids have to be able to see a different future and navigate to it. It is the very science of hope. And in the Camp Hope world, all of our polyvictimization sites have become part of the Camp Hope world. Camp Hope is not being funded by OVC, but our camping and mentoring program, which works with the children and with the adults and gives them these experiences in nature outside of the Family Justice Center environment, and then helps them come up with monthly gatherings where they can connect socially to each other, not for therapy, not for a service, but for relationships. That's what Camp Hope is becoming. And when we first started Camp Hope, we just did it as 1 week of camp in the summertime. And there's a similar program at Joyful Heart Foundation. They tried to do a survivors retreat for just 4 days once a year. Great idea. And when we measured hope in our 1 week camping program, this is what happened. Hope went like this. because camp was great, but it didn't sustain them, and it didn't give them anything to look forward to in life. So we have to create a program that not only increases hope with adults and children, but actually sustains that increase in hope. Just so you know, as an aside, Gallup just found that a 2-point increase in a child's hope score, sustained 2-point increase, is a letter grade in school. A 4-point increase is 2 letter grades. That means a trauma-exposed child can go from being a C student to an A student if you can increase their hope score by 4 points and sustain that increase annually in their lives. We're going to find very similar results in the Polyv initiative with adults. If we can increase a survivor's hope score by 2 points, we're going to find certain positive well-being benefits, I guarantee you. And if we can sustain it by 4 points, we're going to find exponentially higher well-being benefits in the lives of survivors. So that's what we found in our initiative. That's what Pathways to Hope is, the year-round program component of Camp Hope America. We are now in 25 states with Camp Hope America. All of our polyvictimization sites are participating in this, and it's one example of what we think we're going to find in the Polyv initiative. Natalia talked about it. We're going to need arts. We're going to need non-traditional therapies. We're going to need acupuncture. We just had our leadership summit at the Milwaukee Family Justice Center. Gail Strack, our CEO, had fallen and had a concussion, and she was having hearing trouble out of one ear, and she had a Reiki treatment at the Family Justice Center while we were there for the Leadership Summit, and she felt better within 24 hours. Imagine if that was provided in every Family Justice Center in America, instead of expecting that there was a trauma reaction, but her issue wasn't trauma. Trauma symptoms masked TBI symptoms at times, and she actually had a brain injury, most likely, that had impacted her hearing. It wasn't simply a trauma reaction to having fallen. She had fallen over in a chair at a family gathering. But she saw the benefit of an alternate therapy practice in a family justice center in Milwaukee. This is Camp Hope America. The reason I wanted to just show you Camp Hope America briefly is I just spoke to the 36 sheriffs, the elected sheriffs in the state of Oregon. And at their annual meeting, their only agenda item was talking about how to expand Camp Hope across the state of Oregon. This is criminal justice reform. This is real criminal justice reform. This is not getting people out of prison or jail. This is keeping people out of prison and jail. This is getting to kids when they're young enough to be able to change the pathway of their ACEs and where they're going in life, and make sure that they don't become that adult victim experiencing those victimizations, because we increase hope in their life and they find other pathways forward in life. That willpower
and that way power to get from a dream to reality for kids, and that creation of hope, that pathway to hope that we're all supporting for these children, is really what's going to change the trajectory of their life.
This is the first time I've ever done any of these things like archery and whitewater rafting.
High ropes course, arts and crafts, hiking.
Hang out, play some cards.
Like at the end of the day, we have campfire. Camp Hope is like a home to me.
Once you get these kids to push themselves and try all these new things, they're able to really discover a side to themselves that they didn't really know existed.
Our goal is to build kids up to really pull out the positive character traits that they have within themselves.
When they cheer their peers on, or at the end of the night at campfire when they're singing their songs and then they get their character trait awards, and just that beaming pride on their face when they are acknowledged for all the wonderful things that they do. With positive reinforcement and caring adults, really fun activities, and that sense of self that Camp Hope brings to them. It's a really valuable resource in the community because it breaks that intergenerational cycle and gives kids the skills to navigate what they've gone through and move forward in life.
Lots of field games. We got like capture the flag, soccer, all that stuff. Team building, getting along, supporting each other, making sure everyone feels good about themselves.
It's really nice because you don't have to think about stuff that's like bad that's happened in your life, and you just get to think about the future and how good it's going to be.
Everyone, it always works together. There's a lot of teamwork and support, and like just everyone, you get to know everybody and you make a lot of new friends.
When I first came here, I was just a little bit shy. I didn't want to talk to anyone, and then as soon as I started getting into it, I started like working with teams, teamwork, and then meeting other cabins, which is amazing.
It really brings hope, and I really love to have some hope and to see people have hope.
It's just so heartwarming to like witness and be a part of, and it's just awesome.
That vision for
a world without domestic violence is possible. And I think Camp Hope is one piece of that puzzle.
This is the first in Oregon, and other agencies throughout Oregon are looking at this as a model. And so for us, this is absolutely exciting to see that this is the first and is just the beginning.
What we're really hoping is that we can expand large enough to serve every child that comes through A Safe Place Family Justice Center, and then partner with other family justice centers across the state of Oregon to bring more kids to the program.
Our real challenge going forward now is to begin to ask those questions. So we have someone with high symptomology and large numbers of victimizations. What now? That's the next phase of our Polyvictimization Initiative. What does community look like that help heals the trauma? What are survivors going to choose the most? Not just locate everything together in their building, but what do they want there? Do they want art? Do they want art therapy? Do they want opportunities? By the way, one of the things we're finding is they want opportunities with their kids, not the adults getting served over here and the children getting served over here. They want opportunities for family engagement. They want to be together and be safe and have fun. And yes, fun is on our agenda for polyvictimization, because if they have things to look forward to that brings them joy and laughter, it is a healing mechanism in their life. So we're going to try to figure out in phase 2 now not only how we use the polyvictimization tool to help survivors contextualize their lives and share what happened to them, but then help them set goals that will take them forward in life, and not send them away with a case plan and a thumbs up, but say, welcome, you get to stay here for as long as you want. I just had a conversation with the Camp Hope young woman who is now a junior in college. She's been with us since she was 12 years old. The journey's not over yet. She still struggles at times with suicidal ideation. She still struggles with motivation in life. She's going to counseling right now, and she said, Casey, what happens when I lose my anger? Because anger's driven me most of my life. And I said, there will be other motivations that you can find in your life besides anger, Emma. There will be other motivations. But she's someone who's been in our life now for 10 years. That's community. And her mom is connected to our life as well, still to this very day. So we have to figure out how to create that in the lives of those we work with. There's some resources there. Our online library, we're now saving all of our polyvictimization work there. Our resource guidebook is available in our online resource library. And we look forward to this ongoing conversation with OVC, with OVW, with HHS, with federal governmental agencies that are working with trauma survivors all over the country to ask the question, what does it look like if we really understand ACEs and then understand lifetime victimization and then begin to play it out in what it means to help survivors heal and thrive in life. Natalia's email is on there, mine is on there, Bryn's is on there. So on behalf of Gail Strack, our CEO, and Natalia and her whole team, thank you. Thanks for letting us share today about the Polyv Initiative. And thank you, Darlene. Thank you, Stacy, for helping us figure this out, because it's going to make a difference in the lives of a lot of survivors. And we're already seeing it. We're seeing survivors just begin to thrive in this. And when I had a police officer the other day tell me that I really need to better understand this whole thing about multiple victimizations, I thought that's a good start. Imagine that the police officer is not just focused on the last thing that happened, which is what they're investigating, but what's gone on long before that day. That's the very tip of the iceberg, probably, in beginning that conversation. But that's the journey that we're on. So we're happy to take any questions, comments, letters of resignation, anything. If you have any thoughts, comments, observations before we wrap up. I don't know, Stacy, if you want to grab Mike, if you have any comments or reactions, thoughts.
I don't have any comments.
Okay.
I could just sit here listening forever. So.
Any comments, questions? Yeah, if you use the mic, then it'll be on the recording.
I was interested in something both of you said around staff burnout with kind of the use of this, and I thought it was really interesting and wanted to hear more about what you thought in terms of pinpointing. It sounded like you were thinking it might be because they're learning about all of these different adverse experiences or negative things, but could it also just been like, wow, my workload feels different or bigger? It's like when you do anything that's new or learning about a new victimization or new maybe responses to other. So I was just interested for you all to talk a little bit about that.
I'll make a comment and let Natalia make a comment. I think it's all of the above, but when you're listening to somebody on everything that's happened in their life for an hour and a half or an hour, instead of what happened on this restraining order violation 2 nights ago that you're now preparing an application for, those are 2 very different conversations. And the depth of the pain and the depths of the robbery of hope gets really ugly in that. And so, yes, the workload dramatically goes up for sure. And the amount of bad stuff you're hearing goes up exponentially. But I'll let you make some comments, and then I want to talk a little bit about hope and what we're finding about vicarious trauma and burnout and hope.
Yeah. So I think, like Casey said, it is that, but I think something that was interesting that we didn't also anticipate was a lot of the questions. So we know that a lot of the people who are in this field are in the field because they either have a personal connection to it or their family has a connection to it. And many of us have processed certain parts of that in our life. So if it's domestic violence or sexual assault and you're doing that work, you've tended to do work for yourself around what that means for your experiences or contextualize that. But something that came up was polyvictimization hits every area of our life, and a lot of us have not taken the time to do the tool ourselves, and then many of our staff people were like, oh, I'm a polyvictim too. And so I think for a lot of it, it was kind of having those connections about their experience, what it meant for them while they were working with clients that was really challenging and caused some of that kind of anxiety or tension or vicarious trauma. And so this time around we partnered with an agency called Vital Hearts, and they do a lot of work about self-introspection about why we're in the field and why we're doing the work that we're doing and what it means to let go of outcomes without disconnecting with folks. And so I think it's a mix of all of those things, yeah.
The other thing that we have found, and now the question is how to operationalize this, is rising hope actually mitigates burnout. So higher hope people navigate through burnout or vicarious trauma much more effectively than lower hope people. So if you've got somebody in the work that struggles with hope in their own life, usually because of their own victimization, they're already in trouble at the beginning of that. And the more they're hearing and the more they're internalizing, the more impact it has on them. We're trying to, it's very clear in the research that we've done that if you can get hope to rise in someone's life, they do better and they're less likely to burn out. I mean, query, what would it look like if we measured hope in every police officer in America? I guarantee you're going to find low hope scores that correlate with suicide rates of first responders, that correlate with the rage of first responders that produces these disparate impacts on communities of color, that may involve the shootings and the other altercations that happen in officer-involved critical incidents. It relates to hope. So it relates to hope for the cops, just like it relates to hope for the prosecutors or the community-based advocates. So we're trying to figure out what that means to operationalize that to reduce burnout and vicarious trauma. I don't know the answer to that question yet. I don't think most of us do. But we do know that if we can increase collective hope in the people working with survivors, they do better in navigating that burnout than if they're left alone to navigate it by themselves.
I just want to offer anybody on the phone or WebEx who you can unmute yourself and you can ask the question if you'd like.
I did see someone asked if you're going to make the PowerPoint available.
Yes, we're happy to make the PowerPoint available in any format you'd like. You can post it or we can post it.
While we're waiting for any questions, can you talk a little bit about organizational trauma and hope and what that looks like in terms of like employee burnout and overload and hope scores?
It's a conversation that we're just beginning in phase 2. Dr. Chan Hellman is actually taking a sabbatical from the University of Oklahoma beginning in August to come to work full-time for Alliance for Hope International. And the framework of that one-year sabbatical is going to be how to create a trauma-informed, hope-centered organization, and what's the benefit of doing that. And I don't know the answer to the question, but it's very clear that organizational trauma has an impact on all employees, and that workload has an impact on employees, and that if you're in an organization where there is a negative environment, and even in our own organization, we struggle with that at times, how do you mitigate that, and how do you kind of overcome that? And so we're giving a lot of thought to that. Chan's going to come to work for us full-time, and we're going to do two things. We want to create a national research and evaluation platform for the polyvictimization work. That's one goal that we have, so that any organization in America that wants to implement a polyvictimization framework can actually measure what they're doing as far as outcomes. And two, we want to figure out what it looks like to be not only trauma-informed but hope-centered. I'll give you an example. We've been looking at performance evaluations at Alliance for Hope International. Federal government has performance evaluations. Organizations all over America have classic performance evaluations. These are your goals. This is what you're supposed to do. This is how did you do on all these things? We just had an initial conversation about performance evaluations at Alliance for Hope International. I think they're going to look very different a year from now, because it's going to be about people setting their own goals. Imagine a performance evaluation where you come in and we say, what are your goals for the next year working for our organization? No, what are your goals? Well, we'll share our goals, but there has to be an alignment between your goals and our goals. And if you're not meeting your goals in this organization for the next year, hope's not going to rise in your life. If you have goals and you can't reach them, we're in trouble, because you're working for us. And if we're sucking the hope right out of you working for our organization, you're not going to have a good experience, and we're not going to get the most out of your work for us. So that's an interesting conversation that we're just now beginning. What does it mean for an organization to be trauma-informed and hope-centered?
I was thinking about everything you were saying about where your staff is learning to help clients figure out their own goals and objectives and figure out the pathways on what they need to do in order to meet their own goals. And I was thinking about the implications for the training that we give to service providers, because we do tons of victim advocacy trainings and this kind of thing. But they are really more like, okay, this is what a victim of crime needs in the criminal justice system. This is what victims' rights are. But it's not, it's more like the client comes in and they tell you what the problem is, and this advocate says, oh, well, I'll fix it by doing this, or you can fix it by going there, or whatever. But it's not that the skills that you need to help a client, serve as a coach or a mentor or something like that. It's not those, we don't teach those baby step coaching skills to advocates in some of our basics.
Yeah. One of the things that Ellen Pence said before she died a number of years ago is she said, we also tend to see people by the services that we offer. So if I'm a restraining order advocate, when a woman comes in and says, this is what my husband or boyfriend did to me, I see her as a potential recipient of a restraining order, and this is what I have to offer, instead of seeing her as a person that has experienced likely a whole bunch of things. And this restraining order piece is actually not the iceberg. It's a tip of something, and you can see how an advocate working on restraining orders, if they don't understand polyvictimization, and if they're not in a collaborative situation where they have more to offer than 3 things or 2 things or whatever their agency has to offer, they're going to fail. You can see why Finkelhor's work is so relevant in the child welfare world. You come into the child welfare system and you only have a few things to offer a victim: parenting classes, substance abuse class, or whatever it is they have to offer. That's it. That's all they have to offer. And they say, well, wait a minute. Tell me, can I tell you about my life? No, we have to figure out whether your children are safe and what you're going to do to be responsible for you can see how if a child welfare worker doesn't understand polyvictimization or doesn't understand hope, that they're going to try to impose whatever their options are for someone in their life. So it has a lot of implications for us to begin to think about what dialogue really means with survivors that we're working with. Instead, when we talk about that with criminal justice professionals, their eyes start to glaze over. Dialogue, we don't have time for dialogue. I don't want to hear about their life. I don't have time. Well, the criminal justice system needs a massive paradigm shift, because if we don't help people contextualize their lives, the criminal justice system will just keep failing over and over and over again. Well, thank you. Thank you all for letting us share today. Thank you to LVC for this work, and we're excited about the next chapter in this journey. We have a lot to learn. This is my 35th year working in the sexual and domestic violence field. I began as a prosecutor 35 years ago. I knew nothing about anything. I know a little more now, but I still have so much to learn. When I started this work, I would never have used the phrase white male privilege, and now I do, because now I understand my own journey in all of this. And I never would have told a living soul that I score a 5 on the ACE scale personally. That I, too, grew up in a family impacted by generations of child abuse and domestic violence, and carried a lot of that into the anger of my career as a prosecutor, until I began to get counseling and process my own stuff, and realize that there's lots of other people doing this work that need to process their own stuff, too. I'm not done in that journey by any means at all, but this is a good start. So thank you all. Thanks for letting us share with you today.
Camp Hope to me means family. When I'm in Camp Hope, I feel safe.
If I didn't have camp, I wouldn't be where I am.